going to be doing closed inline suctioning on a patient. Before you go into the patient's room, check their chart history and make sure that they haven't had any adverse reactions to this procedure in the past. When you walk into the room, sanitize your hands and put on your gloves. Introduce yourself to your patient. Hello, Mr. Doe. My name is Angela. I'm here with respiratory. And go ahead and listen to their breath sounds to see if they have any indications that they need to be suctioned. So he does have some coarse crackles, so we're going to go ahead and prepare to suction him. We have all of our equipment gathered right next to us. We have our suction catheter, our canister, our Yankauer suction, and our saline in case we need to lavage. The first thing that you're going to do is put him up into semi-Fowler's position. And before you suction him, make sure you hyperoxygenate him for up to 30 seconds. So while he's hyperoxygenating, we're going to check our suction to make sure that it's between negative 100 and 150 centimeters of water pressure. So it is, so we're good to go. We're going to unlock our thumb port and then make sure that we check his vital signs before we begin so we know where his baseline at. So it is, so he's all good. So now we're ready to go ahead and suction. So we're going to explain to him, Mr. Doe, this is going to make you cough a little bit. And we're going to insert the catheter until we meet resistance. And we're going to make sure that we do this procedure for no longer than 15 seconds. While we're doing this, we're watching his vital signs on the chart, make sure he's good. And as we pull back, we're going to use intermittent suction. And make sure that you pull your suction catheter all the way out. After he's done being suctioned, we're going to hyperoxygenate him for up to 30 seconds again and let him recover. We're watching his vital signs while we're doing this to make sure that he's still doing all right. So now that he's recovered, we're going to go ahead and listen to his breath sounds again and check for indications to see if he needs to be resuctioned. So he sounds all clear, so we don't need to resuction him. So since we're done using our suction catheter, we're going to lock our thumb port. And then we're going to use our Yankauer suction and suction out his mouth. And we're going to make sure that we do this on both sides of the ET tube and get everything out of there. And then now that we're all done, we're just going to go and chart and then we're all done.